Hello, and I'm Dr. Michelle Dillon. Today I would like to shed some light on having normal labs but still feeling bad. So many times I talk to patients, excuse me, and they tell me that, oh, my labs are normal. That's not going to be an issue. But a lot of times your doctor will say it's normal, but it's not optimal. Do you want to be optimal or do you want to be average or normal? Because the normal values that your doctor uses are actually averages of the population in your area. So you don't want to be the average population in your area. I think you would want to be more optimal levels. So, for instance, thyroid. So many times I say, I think I'm suspecting the thyroid issue, especially for women, any woman that is past 30, especially those that have had children in any way, they're going to have thyroid issues. Because the thyroid is highly connected to your hormones as well as stress hormones. So there's going to be an issue with it. What most MDs run is maybe one or two markers for the thyroid. What I usually run is closer to 6 or 7 markers, and you can see them below. Most MDs run TSH, and TSH is just a hormone kicked out by the pituitary. So it's kicked out by your upper management in your brain, telling your thyroid, okay, let's regulate some of these thyroid hormones. When you just test TSH, you don't know exactly what's going on because you don't know what the levels of the thyroid hormones are themselves. So I had a gentleman coming in a few months ago who said he was diagnosed with hyperthyroid because his doctor ran a TSH and his TSH was off. It wasn't within normal range. And we ran a full panel, and it comes to show you that it wasn't hypothyroid, it wasn't hyperthyroid, it was actually a pituitary issue. So his pituitary, his upper management, the boss to his thyroid, was not telling or managing the thyroid well, and so he was having low thyroid issues. So they were off in their diagnosis. We just supported him with pituitary support, and he's doing better now. So make sure or ask your doctor, your MD, your primary care physician, your PA, whoever you go to, that you want a more complete panel, not just TSH, but have them run a free T4, a free T3. The difference between T4 and T3, T4 is the inactive form. It's what comes out of the thyroid. And T3 is the active form. So the body actually has to take off one of the iodines to make the thyroid more active. So if you don't know what your active levels are at, then you don't know how your body's doing. So sometimes you can have a high T4 and a low T3, and then you know it's a conversion issue. Your body isn't converting properly from the inactive form T4 to the active form of T3. And usually that happens because people are low in selenium. So eating a few Brazil nuts a day can help solve that. If total T3 is high and free T3 is low, it can be a receptor issue. It could be a conversion issue again. If reverse T3 is high, it could be more of a cortisol issue where your stress hormones are interfering with your thyroid. If T3 uptake is too high or too low, it can be related to the hormones, where your hormones are not being metabolized out of your body efficient enough, and it's actually affecting your absorption of thyroid hormone. If TPO antibodies are high, that just simply means that your body is attacking the thyroid. There's an autoimmune component, and it just means that your immune system is confused and it's starting to attack the thyroid. And usually that's associated with a wheat sensitivity, or the wheat intake of the person is not, it's not advised. So you could see that all these markers will play a role and will tell me and indicate exactly what is happening and what's causing it. Sometimes if it is a hormonal issue, then we may choose to run more hormonal panel. If it's just a selenium issue or a conversion issue, sometimes it's just cleaning up the diet and then giving the proper minerals to help with that. So just running TSH really does not give you a clear picture of what's going on, especially with the thyroid. Yeah, so again, I went into, kind of got ahead of myself, but again, TSH stands for thyroid stimulating hormone, and it's really kicked out by the pituitary to tell the thyroid to kick out more hormone. If anybody's been on birth control for longer than a couple of years, then your pituitary gland is going to be sluggish. So when you take birth control, taking the birth control is taking the pituitary's job away. When pituitary is sluggish, it can cause infertility, sometimes it can aggravate an acid reflux situation, sometimes it just makes somebody not sleep very well. It just can cause a lot of different issues because your pituitary really is it's the boss in charge of all your hormones. So not only your thyroid, but your ovaries, which help produce estrogen, progesterone, your adrenal hormones that are like cortisol and aldosterone. So it's really important that your pituitary isn't sluggish. Sometimes the fluoride in toothpaste can harden the pituitary and cause pituitary imbalance. So also cell phone use. When you use your cell phone, you should try to keep it at an arm's length away from your face. Keep it on speakerphone, keep it away, especially for young children. Children don't have as thick of a skull as an adult, especially children under the age of 12. So they should not be putting the cell phone up to their brain because you're radiating their little brains. So keep it at an arm's distance. Get a little cell phone electromagnetic radiation cancel out device it's stickers that you could put on your cell phone. I just try to use it always on speaker. Don't put it up to your head. So that's a little bit of a tangent, but so TSH is important. The thyroid hormones, T4, T3, checking the different forms. Again, I'm hitting it home, but I want to get this through to you. And know that if you're not feeling well, it means that there's a deficiency, there's an imbalance, there's something going on. Symptoms are a way of your body telling you, hey, there's something not right, I don't feel good, please help me. But a lot of times people will turn to over-the-counter medicines, which will take away those symptoms and make them feel better for a short period of time, but it's not addressing the cause of the problem. So you really want to find the cause and address it so that the body can heal itself and be happy and be symptom-free. Because there are reasons for everything. Symptoms are usually caused by deficiencies. Organs and glands work on nutrients for fuel. So if it's not getting proper fuel, it's going to become deficient and then imbalanced and then more susceptible to infections. Sometimes if you have a low-grade virus always going on, like Epstein-Barr, mono, any kind of virus, it can affect everything in the body. So viruses and bacteria, if it's low-grade chronic all the time, then it kicks out something called a cytokine, which is really inflammatory. Cytokines can aggravate allergies. It can interfere with sleep. It can cause more inflammation, so you can have more joint and neck and body pains. Sometimes people with a lot of food allergies can have an increase in these cytokines, and the food allergies can throw off the immune system, which can cause more imbalances and more symptoms. Toxicities are becoming more and more common with more and more chemicals and products coming into the environment. We're having more, it can affect your biochemistry and your chemistry in your body, which can cause more imbalances, which cause more symptoms. Know that any medication that you take does come with a cost. Most medications cause imbalances in your nutrients. They need a lot of B vitamins or other nutrients to help metabolize them out of your body. So if you're taking a lot of medications, you're probably going to have a lot of deficiencies unless you're supplementing with the proper nutrients. So are you ready to feel better? Are you tired of going to the doctor and saying, oh, everything's normal? So if you are interested, feel free to give us a call. We can run a full thyroid panel. Sometimes I'm able to get it covered by insurance. Sometimes I'm not. It just depends on what it is. But most of the time, to run a full thyroid panel, it's $150 out of pocket, which is a really good price. If you do try to do it online or go through other doctors, sometimes they charge double that. But especially if you're having any thyroid issues or know anybody that has had thyroid issues, please send them this lecture because they're in need of some support, because a lot of times people get on, they get diagnosed with low thyroid and then they get on Synthroid and they're still having thyroid issues. So they're not feeling well. That means that they're, whatever that deficiency, that imbalance is not being addressed. So low thyroid symptoms would be constipation, dry skin, weight issues, memory issues, sluggishness. You could read it there. Most people with chronic thyroid issues will have more of a puffier area around underneath their chin and their neck. It's because the thyroid is not being supported. So let's get you feeling better. Let's get some blood work done. Let's find the cause of the problem and get you on some things that will help make you feel better. So if you're interested in taking the next step, feel free to visit our website, charlottenaturalwellness.com. You can check us out, schedule online for a free 15-minute consultation. That way our doctors can ask you how you're doing, make sure you're a good fit for us, make sure we feel we can help you. If you are out of state or out of town and you're not able to come in physically, we are doing more distance appointments where we have video chat and we're able to send you supplements from our online dispensary. So that's not a problem. So really my passion is to help people feel better, especially moms that are parents, because when you're feeling better, you're a better parent. And when you're not feeling well, then you just don't have the patience. So help me help you. I hope you have a great, blessed day. Take care.